Say you've been suffering from hip pain for too long, you've already had an orthopedic consult, and you finally decided that you're gonna have total hip joint replacement surgery. These are the top 8 exercises that you should start doing about 6 to 8 weeks leading up to that hip replacement surgery. You've got 2 main goals that you want to achieve prior to having total hip joint replacement surgery. Number 1 is that you want to improve the flexibility of all the muscles surrounding the hip joint, which will help post-operatively. And then number 2, you want to increase the strength in all the muscles that support that hip joint. So the first exercise that you want to begin doing is using a recumbent bike, okay? And so if you don't know, a recumbent bike is one of the bikes that you sit in a reclined position and you have that back support. And basically that bike works best prior to hip surgery because it doesn't require as much hip flexion range of motion, which typically is most painful for those that have hip arthritis or severe hip arthritis. You know, the further your knee kind of comes up towards your chest, you probably notice that you have pain in that position. So a recumbent bike does not require as much of that range of motion when compared to like an upright bike, or if you're like a road cycle, if you're cycling outside or something like that. So you'll want to do a recumbent bike for about 10 to 15 minutes in the beginning, even building up to 20 or 30 minutes depending on your tolerance to it. For our next exercise, it's going to be a supine hip external rotator stretch. So I'm lying on my back. I have my preoperative kind of hip leg bent. My ankle is resting on my opposite thigh. And then I'm going to reach down, grab around my knee, and also grab around either my shin or my ankle. At the same time, I'm going to gently slide my ankle towards me. So I'm sliding it up my thigh, and I'm gently pulling my knee towards the center of my chest. And eventually that's going to produce a buttock stretch. So you're going to feel a stretch in your outer buttock muscles, and that's where your hip external rotators live. And so we're not trying to create any joint pain in the hip joint, okay? So if you do feel pain or a pinch when you do this motion, don't pull the knee towards the center of the chest so much. Rather, keep the knee further outside the body and just pull the ankle closer to you. So if you do feel pain in the hip joint, remember, keep your knee further out. But if you can, try to pull the knee towards the center of the chest while simultaneously pulling the ankle up towards you, and then hold that for about 30 seconds. After a 30-second stretch, you'll let the leg out, and we'll do 3 repetitions of the supine hip external rotator stretch. For our third exercise, we're going to do a single knee to chest stretch. So basically, I have my pre-surgical side bent. I'm going to reach down, grab around my knee, making sure that my knee and my leg are outside the width of my body. So think about bringing my knee towards my shoulder. I'm going to gently pull that knee towards my chest, the outside of my chest, until I get kind of a stretch in my center buttock area down here, and holding for a gentle stretch for about 5 to 10 seconds, and then letting it back out, gently pulling back in, and we're going to do 10 repetitions of the single knee to chest stretch. Our fourth exercise is a supine straight leg raise. So for this exercise, you'll lie on your back, your opposite leg is bent, and your pre-surgical leg is straight. You'll pull your toes up towards you, engage your core muscles, so tighten your belly, that protects the spine, and then lift the straight leg raise up to parallel of your other thigh, pausing for just a second or two, and then lowering back down. Again, re-engaging, lifting that leg, slight pause, and down. So for the straight leg raise, you'll do 3 sets of 10. Our next exercise is a supine bridge. So this exercise is going to target the glute muscles, so those buttock muscles. You'll have both legs bent equally, so my knees are bent evenly, about shoulder width apart. My arms are down to my sides, and then I'm going to squeeze my buttock muscles as I raise my hips up. Now notice I still have a slight bend at the top in my hips, so I'm not coming to a full extension bridge where you see some super flexible people get up to, because this engages my back muscles. for our purposes, we're trying to engage the glutes and focus on the glutes. So again, just squeezing the buttocks, coming up to where I still have just a slight bend in my hips at the top for a pause, and then back down. And if you do have trouble, a lot of people do, they forget how to squeeze their glutes. They don't know how to isolate their glutes. So when I in the clinic, I'm talking to them and I'm saying, all right, I want you to squeeze your glutes or your buttock muscles. And they're like, I can't feel it. You know, you just can't, you don't have the coordination yet. So if that's you, you can go ahead and put your hand on your buttock muscles, on your glutes, and that will give you the feedback, that external feedback of when you feel those muscles squeeze. And that just helps with the connection of the brain to the muscles. When you engage the muscles, you feel the feedback from the muscles. So go ahead and just keep your hands on your butt while you're doing it, and then over time you'll just get better with it. But for the bridging exercise, we're going to do 3 sets of 10 repetitions, so 30 reps total. Our 6th exercise is side lying clamshells. So this is an exercise that targets the glute muscles. So you'll lie on your side with the surgical or the preoperative side up. You're going to have both legs bent and stacked. So I'm kind of in like a side lying fetal position. I have my hand on my hips. I'm going to keep my feet together. Lift the top knee up towards the ceiling. So I'm opening up like a clamshell, if you can picture that. So that's why these are called clamshells. Every time I lift my knee, I'm also squeezing my butt, the glute that's on that top side, because those are the muscles that are actually raising the knee up. So as you do these repetitions, you should feel that top glute working the most. So for the side lying clamshell, we'll do 2 sets of 15 repetitions. For our next exercise, we're going to do a side lying hip abduction exercise. So for this one, you'll lie on your side with your bottom leg bent, top leg straight. Your leg is directly in line with your upper body. So when I look down my body, it's really important to make sure that my leg is in line, a straight line with my body. Toes are pointed straight forward, and then I put my hand on my hip. I'm going to raise my top leg up towards the ceiling. Notice I'm still pointing my toes straight ahead so that I'm not rolling back. I'm not pointing my foot up towards the ceiling, because that's what your body is going to want to do. Whenever you have weak hip abductors, it's going to want to roll you back and do this because you'll engage the hip flexors. But don't do that. That's a cheat. We don't want to do that. So keeping the foot pointed straight ahead, I'm lifting straight up towards the ceiling, and I'll feel those hip abductor muscles, which are located in the outer glute area. I'll feel those muscles engage, pause at the top, and then back down. And so we'll do 2 to 3 sets of 10 repetitions, and you should really feel that burn in the outer hip muscles. For our final exercise, we're going to do a sit to stand from a chair. So I've taken a dining room chair here and placed it up against a wall or a hutch or something behind you so that it's not going to slide on you, especially if you have wood floors. So I'm sitting at the front of my chair. I have both feet flat on the floor. They're kind of pulled back underneath me, and then my feet and knees are shoulder width apart. Now you can start with your arms crossed, so this is going to be harder. If you have to kind of press up with your hands because you're really weak, that's okay to start with, but you definitely want to progress to where you're not using your hands. So lean forward until you feel your weight on both feet, and then drive up into a stand position. And then you also want to controlled sit back down, so don't just plop down. We want to stick your butt back and sit back down in the chair. Lean forward till you feel your weight on your feet. Drive through both feet as you stand up. Stick your butt back and slowly sit back down. So we'll do 3 sets of 10 like this. Give this video a like to help support my channel. Make sure to drop any questions that you have in the comments below. And then you'll definitely want to continue watching my hip strengthening videos next as you continue on your pathway to living a healthy and active lifestyle.